All right, so it hasn't quite been an hour, but I'm going to recall the list that I just did in the previous video, and then we're going to memorize an entire another list as well. So, all right, so here we go. So this is going to be for joint effusion. So the indication here is the management of a large joint effusion. Contraindications to this would be allergy to the local anesthetic, bacteremia, or cellulitis. Do you have any allergies? Confirm your name and date of birth for me. We're going to do layman's terms. This is what I'm going to do. Aspirate. We're going to send it off. The anesthetic, blah, blah, blah. Some complications of what we're about to do are allergy to the local anesthetic, blood in the joint space, and cartilage trauma or damage to the cartilage. We could also give you topical or oral pain med, but you can get persistent pain or persistent infection with that. Do you have any questions? Do I have your consent to proceed? Going to make sure I have my PPE on. Mayo is set up. Medication, expiration, lot number, content. Then I'm going to go ahead and make up my cocktail. So 50 Lido, 50 of the steroid with the Lido first. I'm going to make sure the knee is bent at a 30-degree angle and that my patient is supine. Then I'm going to make sure I palpate the patellar tendon ligament, tibial plateau, and the femoral condyle. Is that everything? Patellar ligament. Yeah, I think so. Going to go ahead and clean the site with chlorhexidine. Going to go ahead and anesthetize with ethyl chloride. Going to go ahead and then do my actual aspiration. Why would we be sending these out? 3 reasons. 1, to look at the count and the appearance of the cells. We're going to send it out for cultures, and then we're going to check it for crystals, like for gout and pseudogout. We are going to, then I'll finish up the actual procedure, make sure I put pressure on it, make sure my patient is doing okay, put a bandage over it. They can wash it with warm soapy water every day. Pain meds are going to wear off in about 1 to 2 hours. You can take Tylenol for that. Red flags, so fever, pain, redness, swelling, give us a call. Come back in 3 to 5 days. I would document appropriately. Do you have any questions? Wash my hands. All right, so then I'll just do a quick audit, just make sure I got everything. I'm pretty sure I did. There we go. Cool. Okay. So we're going to move right on to the next one. So this one is going to be naltrephination. And all right, so we're continuing on in my apartment here. We skipped like a little bit, but we're starting at a different section of my apartment and we're going to go through. All right, so this is my little air purifier. So we're managing a painful, simple subungual hematoma with the nail fold intact and a minimal nail disruption. Geez, okay. A simple hematoma. Yeah, I mean, after time, I'll remember this, but in the air purifier is a, it was blood. A hematoma. Nail fold is intact. I fold a blanket over it and minimal nail disruption and lay an intact nail on top. Undisrupted nail, whatever. All right, contraindications, avulsion of nail from nail bed, and it's been greater than 48 hours. All right, so this is a little crate of dog toys. So inside of the crate is a bunch of fingernails. It's gross. And then we need something for 48 hours or 2 days. Probably just put 4 8-balls in there and then 4 8-ball pool balls in there for 2 days. All right, and then the chair is going to be, I'm going to move over Arlo's allergy stuff. So Arlo's allergy meds. Countertop is usually where I have my keys. So metal, tetanus, acrylic nails. So in my dog's food and water, I'm going to say are colorful acrylic nails in his food. Okay, so the first 5. So the indication here is the management of a simple subungual hematoma with the nail fold intact and minimal nail disruption. Contraindications to this would be greater than 48 hours and that the nail is missing, is gone, is separated. Do you have any allergies? You up to date on your tetanus shot? Are you wearing acrylic nails? If you are, we can't do electrocautery. Okay, all right. So my dad's Vikings rug is next to neurovascular status. So pull up the rug and there's a pipe and a wire underneath. Check for extensor tendon injury at dip. So this is above the washer and dryer. So there is an Olympic diver up top going for a dip and stretching, extending out. Dryer, 50% of nails involved need to get an x-ray. So we'll say like half of the dryer is filled with cement. And there's an x-ray film on the other half. Washer, verify name, date of birth. We'll say like my old license is in the washer and is all faded. Picture on wall, layman's terms. I don't know. We'll just say this is a mirror and I'm talking to myself about this procedure. All right, so our management is going to be for a simple subungual hematoma. Contraindications would be it's been greater than 48 hours. Oh, wait, hold on. I missed something. I'll go back in a second. So simple subungual hematoma, as long as the nail fold is intact and the nail is relatively undisturbed. Contraindications would be greater than 48 hours after it happened, and then the nail is avulsed. Do you have any allergies? Are you up to date in your tetanus shot? Do you have acrylic nails? If you do, we can't do electrocautery. I'm going to check neurovascular status. I'm going to check for extensor injury at the dip. If greater than 50% of the nail is involved, I have to do a radiograph. I have to do an x-ray. And can I have your name and date of birth? And okay, this is what we're going to be doing. Cool. Okay, moving on. Now we're inside of my bathroom. All right, inside the bathroom, relatively painless. Block would be more painful, but can do it if requested. I take a syringe and pin the towel to the wall for a digital block. So just kind of explain what that's all about. Bathroom scale, oozing of blood and loss of nail. So I step on the scale and ooze comes out from the pressure. Then a monster comes out and eats my nail. Toothbrush area, alternatives rest or ice. I don't know. There's a big ice block here and I rest my hand on it. Almost like I went to a Titanic thing once and like you put your hand on the ice and it like made a like an imprint. The sink itself, alternative to these alternative risk, nail deformity or loss. So it's just like all the same. So nail deformity, I try to pry open the like sink stopper thing and bend my nail. And then the whole thing comes off. And then mirrors, just any questions. So we'll say there's like a bunch of text over the mirror of like a bunch of questions and stuff, or maybe like yeah. I was thinking about like the Joker in a Dark Knight, like writing something on it. Just the amount of time of me trying to come up with the mnemonic, I won't forget what I'm trying to say. Text is all over the mirror. So ask for questions. All right. So our indication is going to be the management of a simple subungual hematoma, as long as the nail fold is intact and that the nail is relatively undisturbed. Contraindications would be greater than 48 hours, or if the nail is avulsed. Do you have any allergies? You up to date in your tetanus shot? Do you have acrylic nails? If so, we can't do electrocautery. I'm going to check neurovascular status. I'm going to check for extensor tendon avulsion at the dip. Greater than 50% nail involvement, would need an X-ray. Can I have your name and date of birth? Layman's terms, here's what we're going to do. Okay, into the bathroom now. So a digital block is going to be more painful than the actual procedure itself, but it's an option. Some complications of what we're doing today would be oozing from the site or loss of nail. Alternative here would be rest and just ice. But there are complications of that as well, meaning like the bending, the warping, deformity of the nail, and then loss of nail as well. And then do you have any questions for me? Okay. Nail deformity, loss of nail. Any questions? All right. We're already 15 in. Okay, so consent to proceed. All right, so the patient is signing a waiver on the toilet paper. That's pretty interesting. That's pretty funny. Trash can, PPE. I take out my goggles from the trash can. Mayo station above toilet. So above the toilet is just like all the equipment I need. I laid out like a table. My bidet, clean with non-alcohol cleaner, so chlorhexidine. So this is really important because alcohol is flammable. So we'll say like Clorox bleach is oh, well, Clorox bleach is coming through the bidet. Not going to forget that. Firm surface and restrained with my non-dominant hand. All right, the toilet bowl itself. I lay the arm across the top. Almost like when they clean a bathroom and they put like that little piece of paper over. I lay the arm across the top with my non-dominant hand. Okay, so 1, 2, 3, 4, 5. So simple. Hi, my name is Anthony. Subungual hematoma, contraindications greater than 48 hours or a nail avulsion. Do you have any allergies? You up to date in your tetanus shot? Do you have acrylic nails? If not, if you do, we can't do electrocautery. Check neurovascular status. Check for extensor tendon injury at the dip. Greater than 50% of the nail involvement would need an X-ray. Can I have your name and date of birth? Layman's terms, this is what we're going to do. Digital block really isn't necessary. It's more painful than the actual procedure itself. Complications would be oozing or removal of a nail. Rest or ice would be an alternative. Warping, derangement, disfigurement of the nail or loss of nail would be a complication of that. And then do you have any questions for me? Do I have your 1, 2, 3, yeah, 4, 5. Do I have your consent to proceed? I'm going to make sure I have my PPE. I'm going to make sure my Mayo station is set up. I'm going to use chlorhexidine, and then I'm going to make sure that the limb is kind of firmly placed and held with the non-dominant hand. Nail deformity. I don't know why I can't think of the word deformity. Okay, all right, making progress. All right, so the toilet brush itself, so this would be doing the actual cauterization. So, and the thing is, like, I am visualizing this area in my apartment every single time I walk through this. That's what I'm actually visualizing. And all this other stuff, I'm just making up on the fly, which is kind of cool. You kind of get to be creative and have some fun with this. It's so much better than just like brute force memorization. So I pick up the toilet brush and it's like, yeah, it might seem like this is a waste of time, but I'm having a blast. So I pick up, I'm laughing. Anytime you can laugh when you're studying or memorizing something, That's what it's all about. So for the toilet brush, which is on fire, and do my cauterization. Oh, I have like a sponge and some CeraVe. I don't know. I put the sponge on their forehead, like they're sick or something, and ask them how they're doing. Shampoos, dress the wound. My shampoo bottle is wearing a dress. Change dressing daily. So the top faucet, this is like my top thing. So I actually just put a new shower head on. So I change the shower head every day. So change the dressing daily. Bottom faucet drain drainage. Oh, that's so cool when it lines up like that. Drainage may continue for 24 to 36 hours, so 1 to 1.5 days. I'll probably just remember that, 24 to 36, 1 to 1.5 days. Trying to think of what I usually do for 24. Just like an entire day. What do I do for that? And then to 30, 36 is kind of interesting too. All right, we'll just say it's taking too long. All right. Honestly, I'll probably remember it for 1 day to 1.5 days. And okay, that's it for that 5. So managing a subungual hematoma, as long as the nail fold is intact and and the nail is undisturbed. I got to check the wording on that. Contraindications here would be avulsion of the nail, or if it's greater than 48 hours. Do you have any allergies? Are you up to date on your tetanus shot? Do you have acrylic nails? If not, we can't do electrocautery. Checking neurovascular status, checking for extensor injury at the dip, greater than 50%, would need an x-ray. Can I have your name and date of birth? Layman's terms, digital block. It can ooze, or your nail can be removed. Rest and ice is our alternative, but you can have a nail deformity or a nail removal. Do you have any questions? Do I have your consent to proceed? PPE, Mayo Station, chlorhexidine, put the limb on a firm surface, non-dominant hand holds it. Are you still doing okay? Dress the wound. I want you to change the wound daily. Oh, actually do the cauterization. I skipped one. So sorry. That's like the first of this run of 5. So actually I would do the cauterization. Then I would ask how they're doing. I would dress the wound. They can change the wound every day. And then it's going to ooze, or it's going to drain for 1 to 1.5 days. Okay. Drain to continue for 20 hours. Okay, we're almost there. All right. So now there's another section of my bathtub where I had some dog shampoo. You might lose your nail only. I want to say anyway, which is a result of the hematoma. Nothing we did, not the procedure itself. All right. I empty out the dog shampoo and someone's fingernail is on there, or the cap of the shampoo falls off anyway. Closet door, no need for antibiotics here with intact nail folds and no fractures. Running out of steam here. No need for antibiotics. I'm just gonna say like the door is missing panels, which would be the antibiotics. So don't need antibiotics. Plastic bags. If, however, you had diabetes or were otherwise immunocompromised, we go ahead with antibiotics. So we'll say a bag of candy, Nerds rope at the top of, so now we're in my bathroom closet. Bag of candy, Nerds rope at the top of the closet. So if diabetic would do antibiotics. Contacts, my Q-tips, so Tylenol for pain. That always ends up here. CVS bag, Tylenol on that mid shelf. Now we're at where I have an ironing board underneath. So that's red flags. I don't know. We'll say the iron itself is like burning the ironing board red. Okay. Subungual hematoma. Contraindications would be 48 hours or avulsion of the nail. Do you have any allergies? Do you have your tetanus shot? Do you have acrylic nails? If not, we can do electrocautery. Neurovascular, check. Extensor, tendon, dip, check. Greater than 50%, we would need an x-ray. Confirm your name and date of birth. Layman's terms. Digital block, plus or minus. Oozing, or you would lose your nail. You can rest and do ice, but you can have a nail deformity or lose your nail completely. Do you have any questions? Do I have your consent? PPE, Mayo Station, chlorhexidine, rest the limb with my non-dominant hand, actually do my cauterization. Are you still doing okay? Dress the wound. You can change this once a day. It's going to keep draining for 1 to 1.5 days. You might lose the nail anyway. That's not our fault. That's the hematoma. You don't need antibiotics normally. If you are immunocompromised, like if you had diabetes, we would give you antibiotics. You can use Tylenol for the pain. Fever, infection, redness, swelling. I want you to give us a call. Did I miss something? I'm missing a fifth thing here. No, I don't think so. It was the nail would fall off, antibiotics, diabetes, Tylenol, and then red flags. All right. Good. All right, we have 5 more and then we're done here. Okay. So now we're going out to actually right to my right here. So treadmill. So any questions? My patient is on the treadmill in a game show answering questions. Left window, discuss tetanus shot in layman's terms. So we'll say, my friend, Mr. Layman, is outside. So now we're talking about tetanus shot, and I'm explaining the tetanus shot to him out the window. We have to pick a site. So it's either the glute med, the lateral thigh, or the delt, right? So this is my giant Post-its on the wall. So 3 big Post-its with the anatomical locations. Then the right window, verify contents, expiration lot. We'll say there are a bunch of tetanus meds lined up on the windowsill. And then side table plants actually do my injection. Inject plants with tetanus toxoid. There's other stuff in here, but it's like wipe off the top of the thing and pinch the skin. Like I would do that anyway. All right, so that should be it. So subungual hematoma, as long as the nail fold is intact and there's no disruption of the, there's just no big disruption of the nail. Contraindications, greater than 48 hours or avulsed nail. Do you have any allergies? Tetanus, acrylic nails, candle electrocautery, neurovascular check, extensor, tendon at the dip. Greater than 50%, we would do an x-ray. Name and date of birth. Layman's terms, digital block, oozing or loss of nail, rest and ice, deformity of the nail / loss of the nail. Do you have any questions for me? Do I have your consent to proceed? Grab my PPE. Set up my Mayo station, chlorhexidine, make sure the limb is non-dominant hand, do my cauterization. Are you still doing okay? Dress the wound, change the wound daily. It's going to drain for 1 to 1.5 days. You might lose the nail anyway. That's because of the hematoma, not because something we did. Don't need antibiotics. If you're diabetic or immunocompromised, you do need antibiotics. Tylenol for the pain, fever, redness, infection, swelling. Give us a call. Do you have any questions for me? Okay, we're going to give you a tetanus shot because you said you didn't need one. This is layman's terms of why you need a tetanus shot. We can go in your glute med. We can do your lateral thigh, vastus lateralis, right? And then we could do your delt. We could do your arm, lot number, contents, expiration date, actually give my tetanus shot, give them a Band-Aid. Do you have any questions for me? I would normally document. Have a good day. All right, that's it. I will see you in the next one.